Hello, I'm David Kerr, Professor of Cancer Medicine from the University of Oxford. I'd like to discuss an article that's appeared very recently in the Lancet, and it looks at the impact of minimum unit pricing for alcohol on alcohol-related deaths and hospital admissions in Scotland, my home country. Now, why is that important to me as a cancer doctor? Because we know that alcohol um, underpins epidemiologically a whole range of different tumour types. Anyway, a really interesting experiment. Also looking at the impact of governments and health policy. In 2018, the Scottish Government introduced a minimum unit pricing for alcohol of around 60 cents per unit of alcohol. The idea was that if you drive up the price of getting access to alcohol, that should reduce harm, should reduce deaths, should reduce hospital admissions. Whiker and colleagues did a rather nice, it was a controlled time-interrupted series. The legislation was introduced in 2018, so they looked at our public health databases, hospital admissions, deaths, and so on, for the time span from 2012 to 2018. Did it for about 3 years after the introduction of legislation in 2018, and we used England as a control. England are old enemy when we think about how the union works together. And what they showed was that there was a reduction in fully alcohol attributed deaths by 13.4% in Scotland, and a reduction in chronic hospital admissions related to alcohol by almost 10%. It works. What was also interesting was that the benefits were confined to the lower socioeconomic classes. So one could argue, whether intended or otherwise, that this was a health policy intervention that was targeted at the lower socioeconomic classes, and perhaps one would hope as a consequence that this would reduce the health equity gap. We know that the differences in Scotland are remarkable. When we compare the highest with the lowest socioeconomic classes, there's a 4.5 times a 4.5-fold difference in likelihood of death, benefiting, of course, the wealthy. And the gap between the health equity gap between rich and poor is getting wider, not becoming narrower. So interventions of this sort make a difference. And of course, there's good evidence from other areas in which price control can make a difference. Tobacco, perhaps the best example of it. People have also talked about sugar, fat taxes to see if we could actually introduce those to reduce levels of obesity, overeating, other problems and so on in that way. So I have a really nice study, very compelling data, very well worked out in terms of the methodology, statistics, lives saved, lives prolonged. What it doesn't do is it doesn't tell us about the amount of alcohol that people were taking. Just, I guess it shows that if you're less well off, the price of alcohol goes up, you've got less money to spend on alcohol, and therefore that's reduction results in the reduction in harm associated with it. It's really interesting. There's a thing I hadn't realized about called the alcohol harm paradox. In that when you look at drinkers across the socioeconomic spectrum, wealthy drinkers, poor drinkers, even for those who've got exactly the same consumption of alcohol, there seems to be significantly more harm done to the poor than to the wealthy. There may be some behavioural explanations for this, but they don't explain all of the difference, and more work needs to be done there. So a really interesting story. I think a brave policy put forward by the Scottish Government that has return rewards, and something which one would consider replicating around the world to see what other benefits might accrue from it. I'm very interested to watch further forward over the next 2 decades to see what impact, if any, this alcohol pricing legislation has on the incidence of cancer, looking at breast cancer, some gastrointestinal tumours and so on, in which we know alcohol plays a part in their carcinogenesis. Have a look at the study. I'd be very interested in any comments that you might have. And as always, very, very happy to respond to anything you might wish to ask. For the time being, Medscape is a fine. Thank you.